I'm very pleased to participate in this press conference today on behalf of Woog International, because I've had the opportunity over the past decade of utilizing a number of instruments that had been developed in conjunction with the oral health division of that company. We have been very much interested in trying to help patients who suffer from periodontal disease. This is a problem in oral disease that is of great significance to the general practitioner as well as to the specialist. One of the exciting findings in research of the past 5 or 6 years is to identify specific microbial flora with certain forms of the disease. In the past, that was pretty much restricted to acute necrotizing ulcerative gingivitis. However, as a result of the research centers, many of them supported by the National Institutes of Dental Research, have been able to show that with gingivitis, periodontitis, juvenile periodontitis, and even rapid destructive periodontitis, there are certain flora that are characteristic of those microbial plaques that are found beneath the gingiva. In treatment today, it is clear that the term antimicrobial therapy has been expanded not only to be mechanical, scraping plaque from the crowns and roots of teeth, but also chemical. The use of chemotherapeutic agents to counteract the various microbial flora that have been identified with the forms of the disease in subgingival plaque are now an approach that's being used in many centers. It is also clear that until the advent of this irrigating device developed by Woog International, we had to use mouthwashes on the patient home care side in conjunction with their brushing and flossing. Antiseptic solutions have been developed, and of course, in recent years, the ability to deliver sanguinarine or chlorhexidine to the periodontal lesion has been enhanced by the use of an irrigating device such as the one being displayed today. It is also clear that this instrument has a number of advantages because in conjunction with a brushing system, we also have an irrigating system which can be delivered to the area of disease detachment. I'm very enthusiastic about a study that was recently completed at the University of California in San Francisco, where they tried to evaluate the use of power brushing and irrigation, and compare this to the standard of manual brushing. Not only did the power brush and irrigating instrument prove to be completely safe in the evaluation, but in this very exhaustive and very carefully conducted study, probably the most important study in irrigating devices done in the past 20 years, but it also has shown when looking at such measurements as gingival inflammation, plaque index, attachment loss, and total periodontal health, that the irrigating instrument proved to be extremely effective. Now this is very interesting because all that was used was plain water. This was an attempt to establish a baseline. Knowing now that we have solutions such as those that I mentioned that are available to us, which formerly were used in mouthwash form, chlorhexidine and sanguinarine, we're looking forward to being able to deliver these to the site vis-a-vis the Woog irrigating device. What's also something that's quite exciting to me is the studies that were completed by Klaus Lang in Switzerland have shown using chlorhexidine and the Woog instrument that he was able to demonstrate a reduction in concentration of chlorhexidine as an effective means of countering the microbial plaque of periodontal disease in humans as a result of the fractionation that occurs within the Woog instrument. I think this is important to all of us who deal with periodontal disease in practice, because if we can use antimicrobial agents with less of a concentration, especially in the area of chlorhexidine, we will reduce some of the undesirable side effects such as staining of the tissues. Therefore, it appears that modern technology is taking us into a new era in treating periodontal disease. We're giving the patients and also the profession an instrument which is quite sophisticated, extremely well engineered, to be able to deliver to the site of the periodontal lesion a solution which will become an adjunct to our usual treatment. It's also clear that the problem of periodontal disease will have to be addressed not only by the primary care practitioner, the general practitioner, the general dentist, but also the specialist taking care of the advanced lesions. And in conclusion, I must point out, a statement that was made more than 20 years ago at the Michigan workshop emphasized the point that in the treatment of periodontal disease, the patient is a co-therapist. If we want that co-therapist to practice effectively, we have to have instruments such as the one you're seeing today available to take advantage of what research has presented to us as very efficacious and effective findings. Thank you very much.